My name is Joe Baker, and as mayor of Kennedy, Texas, I'm trying to provide as much updated information as possible about COVID-19 and just how severe it is here in Kennedy and Karnes County. So it's Monday, September 13th, 2021. So let's take a look at the latest data and see how that compares to a week ago, a month ago, and a year ago. Okay, so like we've been doing each week, I've been going to this website, covidactnow.org. Just open up their main page and I'll scroll down. I'll click on Texas. And then I'll find Karnes County and click on Karnes County. And as you can see, we are still at risk level severe. As we scroll down the page, we start to see more detailed information, such as the vaccination rate. The most current number has us at 43.9% fully vaccinated, and it's continuing to climb slowly. If we go back a month ago, we were just at 40%, so we've come up about 4% since then. And I wanted to mention that someone had asked why this number was lower than what they had seen reported in other places. Well, let's take a look at this other website and compare this number to what's shown there. I was able to find the link to a web page at the Texas Department of State Health Services website that also shows vaccination information for Karnes County. If you go to this page and you zoom in and you find Karnes County on the map, it gives some detailed information. It shows that the percentage of population that is fully vaccinated, ages 12 and older, is 58.55%. And as we go back to the COVID Act Now website, you can see it's 43.9%, which is lower than what's shown at the DSHS website. And the reason for this is its percentage of total population, not just percentage of eligible population, ages 12 and older. As we continue to scroll down the page to look at the other data on display here, this is one of the most important areas. This shows the number of cases that have been reported in Karnes County. And the most recent number we have is right up here, September 12th, 2021. And they're reporting an average of 19.9 cases. This is a rolling 7-day average based on the preceding 7 days. And that is a very high number. As we go back through time, for the past month, we've been in this extreme range over here, the top part of the chart. And if you go back farther in time, September through November, we can see we were in the medium range and the high range. So once we reached January, we stayed, for the most part, we bounced up and down, but for the most part we stayed in the critical range. But over the last 2 months, we've seen a dramatic increase in the number of cases, mainly due to the Delta variant. And now we have been up here in the extreme end of the risk range, what they consider extreme risk, based on the number of cases reported in the county. Right now we're averaging anywhere from 10 to 20 cases per day. Back then we were averaging anywhere from 0 to 3 cases per day. So we've seen a 10-fold increase between where we were last year and where we are this year in terms of the number of cases. I want to thank County Commissioner Shelby Dubnik for sending me updated information that he receives. And this email was sent just last week that gives a summary of COVID information that he has. And right here we can see under confirmed cases, we've had a total of 3,035. Probable cases, 458. And this is the really sad part. Fatalities, 42. We've seen this number increase by several over the last couple of months, and it's very sad to see this happening. Active cases estimated 181. Recovered cases estimated 3,254. I came across this article recently while looking for information about COVID-19 and how it's impacting the communities around us. And this article is at the Cuero Regional Hospital's website. The headline reads, Cuero Regional Hospital seeks public support in COVID fight. Lynn Falcone, CEO of Cuero Regional Hospital, said, today your Cuero Regional Hospital, including its clinics, home health, and EMS, feel under siege. We are currently seeing a surge of COVID positive patients in our hospital and our Cuero family clinics, which make managing all other patients a major challenge. And if you scroll down farther into the article, it's a very interesting article. I would recommend you read the whole article. But farther down in the article, this part I thought was especially interesting. In a recent article published by the Victoria Advocate, Dr. John McNeil, the local health department authority for Victoria, DeWitt, and Goliad counties, shared the following when asked how many of the COVID patients he was seeing were unvaccinated. 99% of them are unvaccinated. We don't have a pandemic in vaccinated patients. We have a pandemic in unvaccinated patients, and I hope you quote that. While many are in fear of the vaccine based on its newness, Falcone countered that it has actually been tested since the early 2000s, but then SARS declined. When SARS-CoV-2 resurfaced, so did the mRNA vaccine. I do not share this to debate. It is your decision to vaccinate or not. However, know that each individual that embraces and receives the vaccine, that it does make a difference. The CDC's website features a myths and facts about COVID vaccines page to help dispel vaccine rumors that are often featured and spread on social media. I recently saw this article on the Fox News website with the headline, COVID-19, 99% of hospital admissions were among those not fully vaccinated. And if you read into the article, you can see while COVID-19 cases continue to spike across the U.S., the overwhelming majority of deaths and hospitalizations from the virus continue to overwhelmingly be among unvaccinated Americans, according to data from the Center for Disease Control and Prevention. So to summarize for this week, as of September 12th, we have 19.9 cases per day on average reported, which is a very high level of cases. A week ago, September 6th, we were reporting 17.9 cases per day on average. So we've seen a slight increase in the number of cases over the past week. We remain at a very high, severe COVID-19 threat level for Kennedy and Karnes County, Texas. As always, my prayers for everyone's health and safety. Thank you for listening. For more information about the coronavirus vaccine, please call the Otto Kaiser Memorial Hospital vaccine line at 830-583-9380.